Well, good morning, everyone. This is B. Nichols with DFSS. We'll just give it a few more minutes. People are still signing in.
Yes, and also as you guys are coming in, please make sure you're muted. That way we don't have all the background noise in the back as well. Thank you.
Good morning, everyone. We ask that you mute and you can put your name and your agency in the chat box. We're just giving it a few minutes for people to join.
Hello, can everyone hear me? Hello?
Yes, I can hear you.
Oh,
Yes.
good
Yes, we
morning,
can hear you.
everyone.
Good morning, Dr. Sally. I haven't started yet.
Okay, I was
I
thinking you
was
were
waiting
saying something, but I
that
couldn't
you
hear you.
All right, we're gonna go ahead and get started now that you're on. And we're just asking that everyone else mute. Welcome. This is B. Nichols. I am the Director of Children's Services here at DFSS. We want to welcome all the families, all the delegate agency providers, our DFSS staff, and DFSS consultants for joining us today. And with that, I would like to introduce my co-facilitator, who is our medical lead consultant here at DFSS, Dr. Sally Norfolk. Dr. Sally, if you'd like to go ahead and get started. She is with NovaCare Services.
Good morning, everyone. This is Dr. Sally from NovaCare Services. Thank you, B. And thank you, everyone, for showing up. Really excited to get this kicked off for this year. You know, we have so much we can accomplish, and with the numbers out there looking good right now, we know we can do a whole lot more. Okay. So we are your health support services, and we're working with the delegates in the area of education and doing prenatal and postnatal visits for pregnant moms, also providing health support for the delegate centers, probably those that are having difficulty getting appointment schedules or getting physicals done. We do have Dr. Richardson on board that can assist with those, or even blood draws. If any of the agencies reach out to us and need that support, we'll be able to factor that into what we're doing. Okay. So I'm going to allow everyone else to introduce themselves, please.
Hi, this is Dr. Corcus from Cenrisa Family Dental, and we are the subject matter expert in dental. We're the dental consultants. We've been part of the program now for almost 10 years, and we look forward to continuing the cooperation amongst the delegate agencies and working with the DFSS. Thank you.
Okay. Thank you, Dr. Corcus. Next, please, our subject matter experts, please introduce yourselves. Do we have SGA on board?
Yes, I'm so sorry. Hi, this is Amanda McMillan. I'm the Chief Program Officer at SGA Youth and Family Services, and we are the mental health subject matter people for the delegates. So I'm new to the agency and learning all about our role, but I'm happy to learn. And I also apologize in advance. I do have to jump off in about 30 minutes for another competing meeting, so I apologize for that.
Thank you so much. Anyone from CPS?
Doctor, my name is Gina Pasella, and I'm the Cpsdfss Disabilities Team Leader Facilitator. And we are very excited to be here this morning with all of you. We are the subject matter experts for disability services for DFSS, Chicago Early Learning Programs. We do support 0 to 5, but primarily our work has been focused on 3 to 5. And so we're very happy to be here today.
Thank you so much, Gina. Nice to see you also. And for everyone that's new to this, I'm also new. We cannot glean from Dr. Corcus that's been here for a long time. So don't feel out of place. We're all in the same plane, pretty much trying to get something accomplished. So we're here to support and encourage each other. So don't feel out of place. We're all on the same boat. Thank you so much, Gina. Ideally, we have the nutrition also join us. I'm not sure. Is Dr. Jill or Linda online this morning? Okay, so we had the nutrition experts initially under Dominican University, but we're going to be working close with them from NovaCare Services to also continue to provide the services that they were providing under Dominican University, and that will be under that will be provided by Jill and Linda whenever they're able to join. We'll welcome them. So, B, do you want to go ahead with purpose, or do you want me to continue?
Thanks, Dr. Sally. We have 2 more consultants, Erickson and UIC.
Thanks, B. Good morning, everyone. This is Nicole Nashapuri, and I am representing Erickson Institute. And Erickson also supports support to the disabilities component. We work alongside with the CPS team, Gina's team. So it's great to see everybody today. I might be a familiar face to many people, but I am just representing Erickson in this capacity as they continue to build their team.
Thanks, Nicole. Good to see you. And UIC, Josh. And Shelley. I think Shelley's doing it too.
Well, hi, my name is Laura Brown. I work with Joshua. I am one of the disability specialists at the Resource Center for Autism and Developmental Delays. We provide free resources, referrals, and trainings to both families and providers. Currently, we're in a hybrid model. So our 2 centers are open by appointment only, but you also can reach us on the phone. We do consultations, online as well. And we have an interactive website that I will put the link in the chat where you're able to also get free materials and sign up for our trainings. Thank you.
Thank you, Laura. Shelley, did you want to add to that?
Actually, we were just, Laura was representing UIC today. We're the family engagement arm, and more to come.
Thank you, Shelley. Okay, back to you, Dr. Sam.
Okay, I'm muted. Oh boy. Okay. So a little bit, I know we just introduced ourselves. So the SMEs will pretty much tell you a little more about what every one of us do. And going by the slides, if you can go to the second slide, please. Okay, so NovaCare, we work with individual delegate agencies to provide health assessment for families that DFSS caters to, and also education to those centers. Education topics might go from anywhere from OSHA to compliance to infection control, even down to diapering or febrile illness, things like that. We can provide education to support them. We do provide these services in the centers, virtually, or in the client's home as the season or the era we are in now permits. So we partner with all these agencies to make sure that we are making positive impact on the health and the growth and development of the children that are under this program and their families also heading towards a healthy community. Next slide, please. Okay. So our leadership team, myself, Dr. Sally, we also have Dr. Richardson, who's our medical director. Unfortunately, all the time that we have our Hsac meetings, she's able to listen in, but not pretty much talk because that's also her clinic hours, but she's open to referrals in case there are kids that are not able to get appointments with their primaries to get the required physicals done and to get the documentation completed. She's available and her contact information is there. We also have our program director, Miss Ifoma Okoli. She goes by Ify. I believe she's also online. She handles logistics and also assignments and keeping the communication with our delegate agencies going. Next slide, please. So as a healthcare, a health support service provider, we inform, we educate, we empower parents, especially our new moms, things like lactation training, infection control, help making sure that they know what to expect when they go to the doctor's visit as to paperwork to complete, and also the immunizations that their child will be getting at any point in time. So before they schedule the appointments, they can look at the chart that we provide to them and see what to expect when they get there. Okay. Next slide, please. Okay. So in collaboration with other SMEs and the delegate agencies, remember I said our goal is targeted towards a community. A healthy community comes from healthy individuals and healthy families and children. So through this platform, we're able to collaborate with all the partners on board to ensure that we're able to identify, solve, and resolve some health problems while minimizing the effect of the ones that we cannot solve. Like the COVID, it would be a good thing to see it eliminated, but in the meantime, we need to minimize the impact of whatever variant that we are seeing out there. So infection control, PPE use, and availability are big on our list at this period. Next, please. Okay. So our nurses, we have a team of nurses, registered nurses that conduct health assessment, and they also do part of our education. So we've had some delegate agencies that reach out so that they can be able to complete the education for their staff as required. So our nurses go out, if possible, if they are able to do home visits, they still maintain their 6 feet apart, do their gloves, and also use that opportunity to teach the people in the house or the mother how to use those PPEs. We're also able to do some virtuals, especially if there's a crowded home where the in-home visit is not feasible at this time. But since last year, it's been more of the virtual than the physical face-to-face. So during that assessment, they're able to identify the needs of the family health-wise and also educate them on what to expect. So we also help in developing policies and plans that support the agencies and community health efforts as a whole. Next slide, please. So our service model is to assess, and that is using the information that's available, data that's been collected by the city or through DFSS and the PIRL to be able to figure out where to focus our interventions. We also identify trends, areas of need. We provide resources and interventions that will bring about resolution to the problems that we're able to identify. And also to communicate, keeping all the agencies in our communities informed, educated, and involved, especially engaged in the care and the well-being of their community, starting from their family level. So we connect recipients to practical and available resources as we know them. So we're always out there looking for resources that we can provide. And also on the practical basis, we also, during the pandemic era, last year, we're still in the pandemic. So we provide PPEs, gloves, and masks, and paper towels, bleach, Fabuloso, to the families that we're in contact with. Yeah. Next, please. Okay, so pretty much improving our health outcomes for the city of Chicago and our own environment also, that would be our goal. The next one, please. I think that would be the end of the slide. Thank you so much. Okay. So for all the ones that submitted slides, we can go ahead and pretty much take 5 minutes or so to go through it. We have family dental coming up. Dr.
Yes.
Caucus?
Thank you, Dr. Sally. Thank you.
Thank you.
And before you start, Dr. Corcus, I want to remind people that if you have questions as the presenters go through, please use the chat. Go ahead, Dr. Corcus.
Okay, good morning, everyone. And it's a nice snowy morning. It's beautiful out. I actually didn't make it into the office today because I'm in 12 inches up here on the north side. But yeah, I just wanted to start by welcoming everyone for another successful year in the DFSS organization. You know, we truly have created a lot of movement in the last few years, you know, especially before COVID. You know, intertwining overall healthcare for the delegate agencies, whether it's nutrition, you know, dental, medical, vision, et cetera. And we look forward to continuing this partnership. I just wanted to let you know that right now, currently, we are working on I think we have a partner that's going to have a mobile dental van pretty soon that can kind of be pretty much dedicated to the DFSS going forward, and some CPS too, which we're really excited about. I think they might be coming online in about a month or 6 weeks from now. But I want to introduce Elizabeth Flores. She is the Assistant Outreach Coordinator for Cenrisa Family Dental, along with Ellie Milan. And they will go ahead and present from here. Elizabeth, take it away.
Hello, I'm Elizabeth Flores from Cenrisa Family Dental, one of the coordinators. And today I just wanted to talk about some of the services we offer at Cenrisa. I know many of you are very familiar. I just want to do a quick rundown. So the next slide, who we serve. So our school-based dental program serves all neighborhoods in Chicago and surrounding cities. Children between the ages of 0 and 18 years are eligible to receive our dental services, regardless of insurance status. Some of the services we include dental exams, cleaning, fluoride treatment, sealants, and a free goodie bag. To the right, we see our team. Next slide. Oral health education. So with that, not only we provide the preventative services, exams and cleaning, Cenrisa goes beyond that and really sees the importance and really emphasizes oral health education. Prevention is the key, which is why we offer workshops for staff, parents, and kids. And every topic varies to what the school prefers or is in need. Some of the topics are oral health conditions during pregnancy, tobacco use and vaping, thyroid and oral health, baby's bottle tooth decay, and many more topics that we have. To the left, we have Cenrisa Tooth Fairy. The Tooth Fairy, we use it for the kids' workshops. We usually read a book, play a game, dance with the children, really try to educate the students about the importance of their teeth and the overall oral health. Next slide. For case management, we have a case management department where where our compliance officers work with families to find dental resources within their communities. Even a dental home will collaborate with the school to ensure every child receives proper dental care. Next slide. Let's create a partnership. So just a reminder, feel free to reach out for any dental related resources, exams, cleaning, myself, Elizabeth Flores, or Elimian. Here's our information. Also to the left, we have all of Cenrisa locations located in many different neighborhoods of the city. Next slide. And also more coming offices. And just a reminder, February is National Children's Dental Health Month. Our dentists and staff are taking this opportunity to share oral health tips and raise awareness of the importance of pediatric dental care at any early age, through Zoom or in person. Please take the advantage to reach out to set up a workshop. And again, my name is Elizabeth Flores. Our information is in the top. Please feel free to reach out with any dental related resources.
I just want to thank you, Elizabeth. I just want to reiterate that, September will be upon us soon enough. And I know everyone needs to get their examinations in place for Head Start programs. So just be cognizant of that, and maybe we can do some towards the end of this school year. Maybe in April and May also, that I think might work for the September deadlines too. I'm not too sure about that. We'll have to talk to the DFSS. But thank you, and if you have any questions, please reach out to us.
Thank you, Dr. Corker. And CPS is next. Gina, can you unmute?
I'm so sorry, I was on mute, I'm sorry. Good morning again. My name is Gina Pasella, and as I mentioned, I'm the Cpsdfss Disabilities Team Leader. We are very excited to be here again today. We have a unique partnership with the Chicago Department of Family and Support Services, which we're very proud of. And we are the DFSS CPS Disability Subject Matter Experts. And we are proud of our partnership. Could I have the next slide, please? Because we are in this agreement for over 20 years now. So the Chicago Early Learning Head Start Disabilities Support Grant is a unique collaborative partnership between our Chicago Public Schools, the Office of Diverse Learner Supports and Services, referred to as ODLSS, and the Chicago Department of Family and Support Services, DFSS. The Chicago Early Learning programs are who we serve since August of 2000. So back in 1999, a memorandum of agreement was created between these two entities, and that was to cover all aspects of services for children with disabilities, from identifying the children in their community-based programs to referring them to Chicago Public Schools for further evaluation, to ensuring that children receive the evaluations and services that they are entitled to under the law. And so as part of this memorandum of agreement, a team of subject matter experts was created, and the team's purpose is to help fulfill all of the goals of the memorandum of agreement. And we're very excited that the memorandum of agreement is currently being reviewed for signatures. And this year, we will have 6 grantees part of the memorandum of agreement in the city of Chicago. So it's exciting that we're growing and the work is continuing, and we're looking forward to working more closely with all of you and our other partners. Could I have the next slide, please? So as I mentioned, the disability subject matter experts, you may say, who are they? We are specialists in the field of early childhood education, and particularly early childhood special education. And so our team consists of special education teachers in early childhood, licensed clinical speech language pathologists, licensed school social workers, clinical social workers, and we also have 1 administrative assistant. Again, as I mentioned, our goals are tied to the memorandum of agreement that exists between CPS and DFSS. And one of the major goals of that partnership is to ensure our children are fully included in the full range of DFSS programs, that children are not excluded based on their disability, based on the severity of their disability, based on the type of disability, based upon whatever their needs may be. Does the child require, feeding tube? Does the child require special furniture? We are here to ensure that every child has equal access and opportunity to participate in our Chicago early learning programs. And that goes into talking about, we ensure that we're following all of the law, the Individuals with Disabilities Education Act, IDEA, that we're following Chicago Early Learning Implementation Standards, that we're all acting in accordance with the law for serving children with disabilities. Okay, our team is here to support the developmental screening tools, that we are actually identifying children accurately, that we're using the developmental screening tools and social emotional screening tools that are approved by DFSS and agreed upon by CPS. And that's very critical to this work. We are also here to provide individualization and strategies to include children with disabilities in our programs. So this is one of the activities our team is very excited about, when we're able to come out and actually see children in classrooms and see what's working and what may be challenging for the program, and to provide additional supports to make sure that that child is successful in being fully included. And then we also are here to help resolve specific issues for children. So as you can imagine, there are many steps to the process of screening a child, referring the child, ensuring that the family participates in the evaluation, that they're agreeable, that if the child's found eligible for services, that they do receive the services that they're entitled to, whether that be a school assignment at Chicago Public Schools, whether that be bus transportation. So we are here to troubleshoot all of those issues that arise. Could I have the next slide, please? We also work in direct collaboration with the Erickson team to ensure that our children with disabilities who are 2 years, 6 months and older are transitioned to Chicago Public Schools for further reevaluation, if that is the recommendation by early intervention. So not all children will necessarily be referred to Chicago Public Schools for evaluation, but for the children who are identified as needing to be referred, we want to ensure that that happens and happens in a timely manner. Okay, and the last slide, we'd like to invite you to our Education and Disabilities Subcommittee meeting. This will be happening in April. And so we will be sending out a further information about the date and time, but we are excited to be meeting as a group in April.
Thank you, Jean.
Thank you, B.
Up next is Erickson, Nicole.
So again, good morning, everyone. It's nice to see some familiar names on the screen here. Again, my name is Nicole Neshapori, and I am representing Erickson Institute's Birth to 5 inclusion team. A little history of the Erickson team. We were previously referred to as the Infant Toddler Inclusion Program, where we focused mainly on birth to 3 programs or birth to 3 children. But I'm happy to report that this has expanded to be a little bit more inclusive of the whole program itself, to be birth to 5. And so just to go over a few objectives and how to reach those objectives of what the team is. Can I have the next slide, please? Thank you. And so the objectives of the Erickson's team are to ensure proper identification of children who are enrolled in the programs who may be suspected of having a developmental difference. What that identification looks like could end up looking more towards the early intervention side, or it might be a referral more towards the CPS side, depending on age. The team also will provide training and technical assistance to any staff member that is in that realm. So disabilities realm, and a lot of times education overlaps with that. And so providing that one-on-one training and technical assistance based on the needs of each individual site. And then also supporting that transition when it comes time, as Gina had just mentioned. And so the Erickson team works very closely with the CPS team in referrals, transitions, and just together, it's a really great bridge of teams. And so to reach these objectives, what does that look like? What does the support look like from Erickson? Thank you. And so TTA, training technical assistance, can look so different for every need. And so the team is available to do trainings on various topics, such as developmental screenings, overall development, how to individualize for a child, whether they have an IFSP or IEP or not. But just making it true and individualization for anybody who is flagged as a potential developmental difference. That includes observations, both individual and group observations, and being creative during these times, knowing that the complexities given COVID and germs and everything going on right now, just what that looks like will depend on the sites. Individualizations, like I had mentioned, working one-on-one with teachers, working one-on-one with with DSCs to help hone in and link that educational component. And then also thinking about and keeping in mind our disabilities enrollment that we need to keep. So we know that it's a Head Start performance standard to always have a 10% disabilities enrollment. And so we help with teachers learn how to identify when there might be one, what are the next steps to go through a referral, and connect a family, if eligible and if interested, to the proper services. And I can't emphasize enough the collaboration between the Erickson team and the CPS disability team, not just with transitioning children, but overall. We really do work as a team. And while I am here representing Erickson, Erickson is still putting together their team. And so hopefully we hope by the April disabilities meeting to have the coordinator introduce themselves. But in the meantime, I'm assisting on a very limited basis. So if you do have any questions, please feel free to email me and I can connect you to the proper person. Thank you.
Thank you, Nicole. Good to see you again. Up next is Laura with UIC.
Hi, everyone. Again, I'm Laura Brown. I'm one of the disability specialists at the Resource Center for Autism and Developmental Delays. We have two resource centers, one in the Garfield Park community and one in the Bronzeville neighborhood. They are both open by appointment only right now. Next slide, please. RCAD is one of the programs that's offered by the Center for Literacy through the University of Illinois, Chicago. Our primary funding source is through DFSS. And so we primarily work with families and providers who are supporting 3 to 5-year-olds in the Head Start program. However, we do have some other funding sources, so we don't turn anybody away. We even have worked with people who are needing assistance for adults with disabilities as well. Let's see, we do have a Spanish-speaking disability specialist, so we do provide most of our materials in English and in Spanish, along with our trainings as well. Next slide, please. So at our resource centers, families and providers are able to check out materials. We are also able to create personalized materials, visual supports for the family or for classrooms as well. We have printing services, lamination services as well. All of this is at no charge to any of our patrons. Next slide. We also provide referrals. We work with our families, many of them who are with public insurance, so trying to refer out whether they are looking for dental services, speech, mental health, even support groups as well. Next slide. We also provide many trainings. These two are at no charge and they are directed both at families and providers. We are doing these now all online, and we try planning them at a variety of times. So during the day, sometimes the early evening as well. So whether it's getting basic understanding of autism, knowing tips and tools, and as you can see too, most of these are provided in English and in Spanish. You're able to sign up through our Eventbrite page, and I can put that information into the chat as well. Next page or slide. We also provide advocacy work. We have lots of families who will give us a call needing to have more understanding about their child's needs and how it's being provided through the school. So we will look through a child's IEP, help the parents understand their rights and responsibilities and connect them to other resources or who to reach out to at CPS if they have questions on their programming as well. Next slide, please. So currently, as I said, we are doing a hybrid model. We take many consultations either over the phone or on Zoom. We have an online portal where you are able to download many of our visual supports, tip sheets for free through our portal. We also have a link to our trainings. We have tip sheets on there. Might have already said that. To get in touch with us, our disability specialists, all of their contact information is on the website as well. You're able to make referrals or consultations through this. And as I had said before, whether it's for advocacy, whether it's for materials that you're needing as well. And the last page, which I think is, and again, just a big shout out to our partners and our funders, which makes all of this possible at no charge to all of our patrons. Thank you.
Thank you, Laura. And thank you to all of our subject matter experts. We felt it was important that they give these presentations and reintroduce themselves to all of our delegate agencies and families. They have some wonderful resources that are available to you. And so with that, I would also ask that the subject matter experts please put a contact name and number in the chat so that our participants can reach out. Someone asked in the chat earlier if they would be receiving the slides, the PowerPoint presentations, and we will get that out to everyone. And so with that, I'm going to turn it back over to Dr. Hsac.
Thank you, Ms. B. So can we pull up the agenda again so we can get back to it?
Yes, 1 second.
Okay, I'm not, is the agenda up? I'm not seeing it. Okay, thank you so much. Okay. So thank you everyone for presenting, and we continue to reiterate the purpose of the Hsac on every meeting that we have. Eventually, after many times, most of us will begin to get it. So the purpose of the Hsac, I'm going through many screens here. Lord have mercy. Okay. So the purpose of Hsac, the DFSS Chicago Early Learning Health Service Advisory Committee, which is the Hsac, we serve as an avenue where all the partners that we've heard with today and some that are not online, professional, the CEL parents, community partners, and other volunteers. This is a platform where we can meet to support the implementation of quality programming for our early learners, their family, and the staff. So all the participants of this committee can contribute. You know, it's an open platform where we want to hear, we listen, we take suggestions, recommendations in order to make the goals possible for us. So we contribute, we provide recommendations and feedback on the health data that are out there, projects, surveys, and other things that we receive feedbacks from the communities. This is a platform where we sensitize them, where we plan, and where we implement to impact what's going on out there. So based on that, there are the proposed meetings of the subcommittees, the health and mental health, nutrition, dental. We've had our subcommittee meeting. I hear Disabilities saying theirs is coming up in April also. So we still have the family engagement, a subcommittee, and they'll pretty much put on their own proposed meeting times. Then we're gonna gather again during June for the Hsac so that we'll be able to gather every information that we have from the subcommittees, from their meetings that they've had. Taking us back to last year, we were able to look at some data. We came up with questions, we had a breakout, and came up with goals. And this might be a good time to also kind of touch on what's going on with those goals. How are things going with the implementation? Are there things we need to tweak? Some of the goals are achieved, hopefully. Some of them are not short-term goals that can just go away, but something that we'll continue to plan to implement, especially with the pandemic still in place. So that will take us, I don't know, B, do you have anything to add to the committee's schedule? I believe they scheduled their meetings before we meet with the Hsac.
Yes, our next second set of subcommittees, and we're going to do the breakouts in the April subcommittee. And so we will be sending you all dates for those April subcommittees. And we'll break out into one for health, one for family and community engagement, and one for education and disabilities. So look for that information in our CSD updates.
Okay, thanks, B.
Mm-hmm.
So some of the goals that we came up with last year and the action plans, we was split that into 3 places. There's one for health services, one for family community engagement, and another one for education disabilities. And I'm just gonna read that out and then have people input as to what's going on in their different facilities and different sections as to what we're doing with these goals, how far we're going, or the challenges with the implementation, or if there's anything that we need to change. So for health service, the goal was to train family service workers and also to incorporate cultural diversity and sensitivity as part of the training, because we're serving a diverse group of people. And we found that some of the reason why they were not accessing healthcare might have to do with culture, might have to do with belief, what might have to do with information they are receiving out there and from where. So that was our goal, to make sure that we incorporate cultural diversity in the training so that we'll be able to encourage them to seek the help that's available out there. And for family and community engagement, the goal was to develop a platform or a system to distribute and access resources and information on real-time basis. so that information can be shared with the CEL families in a timely manner. For education and disabilities, their goal was to increase the number of children who will receive the IFSP and the IEP services using some objective. One of them is to increase the number of delegate agency staff who will participate to provide those support in those areas. Another objective of theirs is to create a focus group for CEL programs to have a platform to learn from each other and collaborate. And then another objective they have also is to educate parents regarding the importance of their child receiving special ed education. And lastly, to educate families about Chicago public school options. So having said that, we'd like to hear from the SMEs as to these goals. Where are we? What have we done so far? Who wants to go first? Okay, I'll start with the health services on the NovaCare part. And I talked about the cultural diversity, and to incorporate that in training. We have received some requests from some agencies, and one of them actually asked for cultural diversity. There are many information out there that we use to bring in culture into what they do every day in order to not stigmatize and in order to let them know that these resources are not just available to those that meet certain criteria, that regardless of race, color, whatever, all of these services are available and can be accessed. Even for those that have some immigration issues, that does not stop them from getting assessment done. That does not stop their children from seeing a doctor. Those are some of the fears that we heard when we were going through putting these goals together. Some people think you have to be a permanent resident to access this. Some of them have fear of being deported and all that. Bottom line is, we are all here in the city of Chicago, and the status or no status, the healthcare benefit is for all. And keeping one safe is keeping everybody safe. Corona eventually and the COVID virus, they do not ask for color, they do not ask for status, they hit whoever it can hit. So that's part of what NovaCare has incorporated in our training. Okay. Anyone from family engagement, community engagement? Anything going on that side?
Hi, I'm Shelley. I'm Shelley Maxwell, and I put in the chat already a link to a temporary Google Drive. We are reforming or reorganizing somewhat because we lost some funding. We are going to continue with our programs, Parent and Youth Outreach, where we offer financial literacy trainings, parent readiness employment trainings. We have a whole COVID helpline where parents can call, but we are also calling parents and doing an over the phone interview to see if they want vaccine information. Where can they get a vaccine for a child 5 to 11 and up, and the locations closest to them within a mile all the way to as far as they need to go, and maybe they don't know how to navigate the internet to find that information. We're going to do that. We're also doing a pathways program where we're going to do regular trainings to help parents learn how to present themselves, think about their talents, how to convert them to skills, find out about the cost of education if they're not ready to go to work, and many, many other things. So we put a Google Drive link, and I'll put it again in so that but this is a working folder, and some of the flyers don't have the QR codes yet. Parents like QR codes, we found. So we're not just putting links anymore, we're putting QR codes. Most services will be by Zoom. And then one popular thing is 24/7 dads, where fathers can get together in cohorts and talk about, how to be a better dad amongst their peers. We're not telling them how, we're offering information, and then they're doing peer exchange. And finally, we have a family service worker training program, and the flyer is there for when the workshops will take place. So we're doing a lot of things with a lot less people, but we're getting it done.
Great job. Thank you so much. That is a lot, especially in the short period of time. I know these goals, we finalized them in our November meeting, and just a couple of months, a lot is happening. Are there any challenges to getting these goals accomplished, that things we can brainstorm and support each other to get these things done? We heard a lot about what Education Disabilities are doing. From Nicole and from Laura, thank you so much. We are all online to achieving these goals. Any challenges, things we might do differently, things you not want us to add to make these goals attained before we set new ones for the year? Anyone questions about the goals, challenges in achieving the goals that we have set? Questions about the goals themselves? Okay. All right, so we'll remain on that track then to continue on those three areas. And as we meet along the year, anything comes up different, we'll also be able to share with one another. Thank you so much for those that have shared, and those that are listening and taking notes, thank you so much. So B, you want to touch on the PRO data? B sent over some PRO data for last year. And these goals we chose last year was based on the data for 2020. Now the data for 2021 are in, and that's part of what we'll be discussing later when we meet for the Hsac meeting later this year. And based on that, we might see if the goals have changed, depending on what the data is saying, and see if there's anything we can add to the goals or remove some that have been achieved. But that's the point where we evaluate where we are right now. So Ms. B, can you take it over from the...
Thank you, Dr. Sally. And folks are being a little shy. I don't know why. Maybe because they're hearing you, Dr. Sally, but they're not this shy. All of the contractors did receive copies of our PIR data. And for those of you that aren't aware of what PIR is and may be new, that's the Program Information Report. We have to give a program information report annually to our funder at Office of Head Start. So what we do is gather data from what you all put into COLA. And that data is gathered for every program model for Head Start. So we have data for early Head Start programs, TCP expansion, and for Head Start. And so I'm going to get us started, but I would like for the other contractors to jump in and talk about the PIR data. And I'm going to start with medical homes. We are just at about, at least ending December 2021, we were about, I believe, 60-some% in our families having dental home providers. And we were relatively midstream with dental home providers. And so these are areas that we need to really look at that PIR and say, why aren't families accessing? Why, what do we need to do at the delegate agencies to be able to connect families to these medical and dental homes? And so I know there are some other percentages in other areas that the other contractors may want to talk about, but I did want to raise those too. And delegate agency managers, directors, families, if you have challenges, as Dr. Sally said, with achieving these goals, this is the meeting that we need to bring that information up. Maybe there's a particular side of town that we just are not making those linkages. Then we need to know about that. If we're not able to get families signed up with the medical insurance providers, kids can't. We need to know that so that Dr. Sally and the other contractors can help us get our brains around that and figure out how we can help families to get those resources. So I'm going to stop there and open it up to either the other contractors with the data measures that they looked at and or delegate agencies and any feedback.
I can chime in here just a little bit. This is Nicole with Erickson. Just looking at the PIR data, how it ended in December in regards to disabilities enrollment percentages. So children who are identified and have an IFSP in the 0 to 3 programs. I would say some of the important things that I know historically, and it's a constant ebbs and flows, is just the way communication can be really great with the CFC offices, so where you're making those referrals to, and sometimes it can be not so great, and that's due to a variety of reasons, and being overstaffed, being understaffed, or overworked, understaffed, and are we doing in person, are we not, and having the ever-changing environments that we have with COVID and the policies and procedures. But what I would strongly urge all agencies doing is creating a relationship one-on-one with the CFC offices that your children are being served through. And so again, that's based on their home zip code, not the zip code of your site. And trying to establish as best communication as you can with them, and creating that communication and relationship with the service providers for the children who are receiving their services already. It's a really great way to forge relationships with people who may already be coming into your center, or those that are serving children through live video versions through Zoom or whatever platform they're using for virtual. Creating or using that as a relationship start off point is a really great way to spring forward to then potentially help another family that's enrolled in your program. And so just thinking of these things historically that have been, and when I say historically, I'd say during COVID times, during these past multiple years now, but just keeping those things in mind. Gina, I saw that you wanted to say something too.
Yes, thanks, Nicole. I just wanted to piggyback on what you had said regarding the PIR data as well. And thinking about us needing to redouble our efforts. One of the goals for the Disabilities Subcommittee is to increase the number of children who are receiving their special education services, whether that be 0 to 3 early intervention services or 3 to 5 services with Chicago Public Schools. So we had our challenges prior to the pandemic. However, with the pandemic, as you were saying, Nicole, so many challenges facing families. From the 3 to 5 standpoint, families feeling not confident, not having their children vaccinated to come in person to have evaluations done. Also feeling like that a remote or virtual evaluation on a screen for a preschooler is not developmentally appropriate. So we're seeing that impact on the number of referrals that we're receiving. We're seeing that impact the parents' agreeability to proceed with the evaluation. And now add this year, we have national bus shortages of bus drivers to transport our children to CPS for services. And so I think about, we were sitting at 60% children receiving their disability services. And I feel as though we've dropped down to 50% because there's so many factors impacting the children. I know, like what you had said, Nicole, from the CFC standpoint, for the longest time, they weren't allowing providers into homes or into centers. And it took a time for the CFCs to get on board with virtual services. And again, families may not have chosen that. So there's just so many factors that are impacting our children's service delivery that I feel like Dr. Nafor, where you were saying, what, do we need to add anything or modify the goals? I just feel like we have to intensify our efforts. If we were not doing enough before, we have to find new solutions, creative solutions to help the children get the services, the evaluations, and the services that they so desperately need. And I'll just say one last bit, that the PIR data for early intervention reflects that. So Nicole, I think that you would say the same, that sitting at 4 or 5% disabilities enrollment in our birth to 3 programs is historically very low. Historically, we've seen our programs birth to 3 exceed the 10% enrollment mandate glowingly. You know, out of the gate would be at 10, 12, 13%. And here they're really struggling. The good news is for our our 3 to 5 programs, we're doing well. We were at 10% and we were very pleased. And I know our project director, B, you had said, just make sure programs to be, you know, intensifying your efforts to make sure you maintain the 10%. And unfortunately, we dropped down to 9% recently. So we're just more work to do.
Thank you, Gina. We always have more work to do. While we're on it, for our family and community engagement, Shelly, you spoke at length about the services that UIC is providing. And when we looked in the PIR overall, we had a pretty high percentage ending last year. It wasn't 100%. I believe it was in the 80s, high 80s, that families were utilizing resources and asking for at least one referral to resources. I don't know, Shelly, if that's indicative of what you're seeing at UIC, or if you want to speak a little to that. I'm sorry, Shelly did say that she was leaving in Laura. So I'm going to turn it back over to you, Dr. Sally, unless anyone else has any feedback. I see there are a number of DFSS staff that are also joining us. Maybe you've heard something in the field from agencies that you would want to share. This would be your time. Also, agencies, feel free to use the chat. We are manning the chat box.
And just to piggyback on what Gina said earlier about intensifying effort, that was brilliant. And just continue to do what we're doing. We are on the right track, but we can do more. We can do more. And that may include having to reach out again to all the delegate agencies, because even at this point, some of them are still wondering, oh, when you call, what do you do? Are you going to charge us who's paying for this? There is still a lot of education and awareness to create to make sure that they know these services are available. We received an updated list of the agencies that are still participants now, and we're going to do that again, calling every one of them. And hopefully this time they won't say, oh, NovaCare Services, what do you want? And are you going to charge us? So for all the SMEs and all the agencies, that's the reason why we have this platform, to let you know these services are available. And if you're having challenges, there's always somebody to reach out to. And together we can work together to make sure these numbers keep going up and changing. It could be better, but considering what circumstances we are in now, we hope we get out soon. We can do better and turn these numbers around come the end of the year.
And with that, Dr. Sally, I'm not seeing anything in the chat. And so if you would like to go ahead and bring us to a close with next steps and adjourn.
Okay, so next steps. Pretty much we are looking at the meetings that we're proposing. The next meeting coming up in April. Okay, we'll organize on sending out a notice on that one. And now that probably will be where we're also going to breakout rooms. And I'll just say we'll spend time to look through this data that are out there and see what areas pertains to each one of us and come to the meeting prepared to share so that together we can change some things. So on that note, while we'll continue to work on the goals we already have, I pretty much think there's not much on my end to bring about. Okay? And I want to thank everyone for participating. I see a lot of people. We have over 70 people online. That was very encouraging. Thank you so much for coming, even if it's listening in so that you know what's going on. This is our first meeting and we are hoping to meet again by April, correct?
Yes, that's correct. Thank you, Dr. Sally, and thank you all for joining us. We will be bringing you more information on the upcoming federal FA2 audit. There will be more information along those lines. We're working on study guides that we will be sending to our agencies so that you can use those in preparation for the review visit. We do not have a date yet, but we're going to go ahead and begin preparing for it as early as possible. So with that, I want to thank Dr. Sally. I want to thank all of you, and I want to thank the consultants for joining us today. Thank you, Dr. Sally. And we will, I guess, send something out for her and invite in April. Thank you.
Thank you, everyone.